On December 10, 2024, there will be a ceremony to rename Victoria Hospital after Dr. Winston Paris, a physician known internationally for his work in pain management. The event will also celebrate the opening of the Betty Wells Urban Polyclinic, which replaces the Castries Wellness Center. The polyclinic is named after Dr. Betty Wells, St. Lucia's first female doctor. The Urban Polyclinic and the Medical Heights Secondary Care Hospital, which began operation last year, will form the Dr. Winston C. Paris Medical Complex.
The Castries Wellness Center had to be closed because of multiple reports by professionals about the infrastructure and working conditions at the health facility. Additionally, services at the Castries Health Center had to be expanded because of the increasing numbers of people from the Castries Basin who access the health center. Moreover, the Castries Health Center also served all St. Lucians who visited Castries and required health services. The idea of a polyclinic for Castries had been discussed many years ago.
Starting from December 16, the Betty Wells Urban Polyclinic will begin offering primary healthcare services in a phased approach.
The general medical clinics, diabetic and hypertensive clinics, the management of minor wounds, dressing services, urgent care and pharmacy services will be provided daily, including Saturdays, Sundays, holidays from 8 a.m. to midnight. And this is the first phase. In the second phase, which will be in the year of 2025, the services to be available at the Dr. Betty Wells Urban Polyclinic will include antenatal and postnatal clinics, the child health clinic, family planning clinic, cancer screening, HIV testing and counseling, and home visits.
The Chief Medical Officer outlined other services offered in addition to this basic package of primary healthcare services.
Adolescent health clinic, men's health clinic, physical activity programs, reproductive health clinics, hearing health services, daily dental services, nutrition services, community mental health services, counseling services, and specialist clinics from visiting consultants as required.
Eye care services are also being offered at the newly established National Eye Clinic, an amalgamation of the Cuban Eye Clinic and Diabetic Retinopathy Clinic.
The National Eye Clinic will be providing general eye services, diabetic retinopathy screening, laser treatment from Monday to Friday from 8 to 4 p.m. daily. And the services of the National Eye Clinic started on Monday, December 2nd. We already have clients utilizing this service.
Health Minister Moses Joe-Baptiste noted that the upgrades mark a new chapter in the government's efforts to provide accessible, high-quality healthcare services to the people of St. Lucia.
Both clinics have benefited from newly refurbished facilities with new equipment. Training for the use of the new equipment started about 2 weeks ago, and that training is ongoing. Patients are now accessing the National Eye Clinic, what most people know as the Cuban Eye Clinic. They are accessing the clinic once again in more comfortable and upgraded facilities for services and in preparation for surgeries. We have new biomedical equipment, and I have a whole list. I'm not going to name all of the equipment, but we have brand new equipment at the Dr. Betty Wells Urban Polyclinic.
Eye surgeries will begin being facilitated from January 2025. For the DBS News World, I am Zane Romulus.